So, hello, thank you for joining Casita Maria and Montefiore Bronx Collective today to learn all about the COVID vaccines that are available right now. My name is Alejandra and I am the Community Outreach and Family Engagement Coordinator here at Casita Maria. And thank you so much for joining us. I will also be translating this event in Spanish. Bienvenidos a todos, gracias por unirse con Casita María y Montefiore Bronx Health Collective para aprender juntos información sobre las vacunas de COVID-19. Me llamo Alejandra y soy la coordinadora de participación familiar y comunitaria de Casita María. Le pedimos que, well, it's okay, we don't need that. So, gracias por venir a este evento. I have worked in the Bronx community for the past 3 years, and my job at Casita is to engage, educate, and inform community members and families about current events. He trabajado en la comunidad del Bronx por casi 3 años y en Casita es mi deber de educar, informar y hablar con miembros de la comunidad y familias de eventos actuales. So we do have some pre-made questions beforehand, and we'll be answering them in our Q&A session. I am fully vaccinated, so if there are ever any questions that anyone has about that, I would be more than happy to share my experience, and I'll include my email in the presentation, and we can also include it in the Facebook Live. So let's move on, and we are joined by Leah Hardigan and Dr. Rafael Frias from Montefiore Bronx Health Collective. They will be talking to us about everything we need to know about the vaccine. So nos acompañan Leah Hardigan y Dr. Rafael Frias de Montefiore Bronx Health Collective. Nos hablarán de todo lo que necesitamos saber sobre la vacuna. Okay, so now I'm going to turn it over to Dr. Rafael Frias. Ahora se les voy a dejar al Dr. Rafael Frias.
All right, welcome everyone. Bienvenidos a todos. My name is Dr. Rafael Frias. So a little about me, there's some opening statements here. I have, not making any money off of this. I don't work for any vaccine maker or pharmaceutical company. Local family medicine doctor. A little bit about me, I'm originally from Dominican Republic. I was born, came here when I was young, grew up in Brooklyn. Went away for college, but came back to New York. I studied at Albert Einstein and have stayed in the Bronx since then. And live in the Bronx as well. So our clinic is, I think, pretty close to where you guys are at. We're on 161st and Prospect. So hopefully with today's talk, we'll be able to answer a lot of the questions and, hopefully give some, a lot of good information for everybody and maybe dispel some myths. Basically there's a lot of things out there you hear on the internet. So hopefully we'll be able to, make sure people have, all these myths or lies or misconceptions and things that people hear but are not necessarily true. We can talk about that. So just some opening statements there, and then we want to do a quick poll. And just it's anonymous, just to see how likely people are to get the vaccine.
Not sure. Oh, we can still do this. Even you guys can feel free to fill it out yourselves.
Yeah, we can definitely just do it just so that they get an idea. So those of you that are on, please feel free to answer the poll. So I'll give you all like a minute to do so. And those of you who are on our Facebook live stream, hello, thank you for joining us.
Thank you.
Bienvenidos a los que estén en el Facebook live stream. Hola.
Y por todo que hablan español, por favor, si tienen preguntas o lo que sea, como oyen, yo hablo español también, so puedo darle las respuestas a sus preguntas.
I'll end the poll right now, just so that people can see. So 50% are extremely likely to get the vaccine, and another 50% of people have already gotten the vaccine, myself included.
Okay. So let's talk about the coronavirus or COVID-19. And basically, so there's actually millions of viruses. There's a lot of viruses out there. Coronavirus is just one of them. The coronavirus is actually, it's one of the viruses that causes a common cold. But this one in particular, which is, was given the number 19 because it was in 2019 when it basically started coming out. It's a little different in that it really doesn't matter who you are, age or ethnicity or race or creed, doesn't really matter. It can affect anyone, right? And here we have listed just some of the symptoms that people get. So some of the things that people feel if they get infected. Not everyone gets this. Not everyone gets every symptom. And there are people out there who are what we call asymptomatic, which means that they don't get any symptoms, but they're actually were infected and they can actually spread the virus to other people. And we'll talk about some of those things. But most commonly, people will feel, if they do feel anything, are fever, cough. Also, the loss of taste or smell is a big indicator that people might have been infected. And, for some people I mentioned, they don't get any symptoms. And then there are people who do get them and they can last a couple of days, sometimes a couple of weeks. But we do have what we're calling people who have what's called long COVID or COVID haulers, basically people who have symptoms for months. I've had patients who've had COVID for symptoms for a year. So it can happen. And we just still don't know why some people do it. We do have some theories, but we also don't even know why some people get it and some people don't. Yeah, you can go to the next one.
Sorry, this was supposed to have a graph that didn't make it in.
So, well, our main thing for today, is talking about the vaccine. And right now there are 3 approved vaccines in this country. There are more out there in other countries developed by other nations, but in the US, there's only 3 of them, which are the Pfizer, which is the one that came out first. Then there's also Mrna, which both have this kind of similar ways of how they work. And then the newest one in play is the Johnson & Johnson. The differences are, besides how they kind of work or how they deliver the medication, is the Pfizer and the Mrna are 2 doses, and the Johnson & Johnson is 1. So we'll go over that, but just to translate those 2. So por ahora nada más vamos a hablar sobre los 3 diferentes vacunas que tenemos contra COVID-19 en este país, en los Estados Unidos. Ahora por ahora tenemos el Pfizer y Moderna, que son las que son 2 dosis, entre 3 a 4 semanas entre cada dosis, y el más nuevo es el Johnson & Johnson, que es 1 dosis. Y tienen un poquito de diferencia en cómo trabajan, pero toditas combaten COVID-19. Y para que sepan, todas están aprobadas por el FDA, que es la agencia gubernamental que se encarga de medicinas y vacunas y tratamientos nuevos en este país. Pasaron por muchos reglas rigurosas para estar aprobada. So I was just mentioning in Spanish that, the FDA, which approves all these, any new medication or treatment, or like vaccines, put it through very like rigorous standards. There were testing done, lots of participants and that sort of thing. We can talk a little bit about that as well. So before we even go into how these work, we'll talk about just in general, like in kind of like the olden times, I guess, of how vaccines worked before, where you basically had a dead or a weakened form of a virus. So we'll take the flu virus, the flu vaccine as an example, which has a dead flu virus in it. And then it's kind of grown in something, because it can't just like live on its own like that. So it has to be grown and then reproduce. It has to be made in these huge quantities. And then basically what happens is you inject that dead virus in your body, and then your body sees that, it recognizes that it's not part of you, and then it makes what's called antibodies, the protection. And then that's basically how then you're protected each time, for the flu, it's every year, because the flu virus is very specific, is very special in that it changes itself every year. So that's what we need to do every year to get the shot, versus like the chickenpox, the varicella vaccine, which is once you get your doses, you're pretty much covered for life. It works a little differently. So I'll just translate quickly in Spanish. So para vacunas, antes, como trabajaban es que muchas veces tienen un virus que está muerta o que está bien débil, que se hace y se administran, se la ponen una persona. El cuerpo reconoce que es una cosa que es diferente y después hace los anticuerpos, la protección necesaria para proteger a uno si está expuesta o está, el cuerpo ve que está cerca de alguien o algo que tiene el virus y puede combatir eso para que no se infecte. Let's go to the next one. So these are a little different. We'll talk about, the Johnson & Johnson, which is, it uses kind of like what I just talked about, where it uses something to, what we call, it's called a vector. It's a term. It's basically, it uses something to, uses like something else in order to give it, for your body to make it. So it's a very, not complicated, but it basically uses another virus, like a dead virus or part of it, in order for your body, in order for it to be kind of put into like a little like compartment, almost like a little box, which is then inside that box, it has the instructions needed so that when it gets injected into you, your body opens that up, it recognizes those instructions, and then you make the antibodies or the protection necessary against the COVID-19. The instructions specifically are against what's called the spike protein, which is what basically attaches or connects to your body. And then that's how the virus starts making itself. It starts making copies of itself, but it has to kind of basically like stick to something in your body. And the spike protein is what does that. It's very, very special. Once that happens, it basically goes on overdrive. It does a lot of different things, and it tries to keep itself alive as much as it can. La vacuna de Johnson & Johnson, tienes algunos aspectos de lo que estaba hablando anteriormente, donde tiene como un pedazo de un virus que es como muerta, pero como si fuera en una caja. Tiene las instrucciones para que el cuerpo reconozca cuando uno está vacunado, que pueda ver qué puede hacer el COVID-19, el coronavirus. So, cuando digo que está como en una caja, está como empaquetado en algo que se fuera como un virus muerto, no de coronavirus, pero de otra cosa. O algo que no va a causar ningún daño, no va a causar que nadie se enferme, sino está totalmente encerrado, y lo que tiene adentro, cuando le ponen la vacuna, es que el cuerpo abre como si fuera esa caja y ve las instrucciones de una de las proteínas de COVID, de coronavirus, de COVID-19. So, no es que cuando uno reciba la vacuna se enferme, porque no trabaja así, sino que el cuerpo empieza a hacer los anticuerpos, la protección. So I didn't mention this before, and I was just mentioning in Spanish that, once you get vaccinated, it's just telling your body the instructions of how to make those antibodies, that protection. You can't get sick from these vaccines. It doesn't work that way. You're not getting vaccinated. You're not getting a shot of a virus, of the COVID. It's impossible. That's not how these vaccines work, which makes it different than from before. You're getting what I mentioned before was the instructions of how your body can make that protection. So it's totally different. And we'll talk about some of the side effects or some of the reactions that people may get afterwards in a little bit. Well, let's go to the next one, which is the Pfizer, Moderna, which are the mRNA vaccines. And then these are they're newer, quote unquote, and we'll talk about this too later, is they're newer in that it's never been used before, but the technology of how to make these vaccines has been around for at least 20 years. It's just that we've never really had to use it before because we've never had a virus like COVID. There's never been an infection like this before, right? So what that means is we have to think outside the box. We have to think of new ways to kind of protect ourselves or make ourselves not get not sick with this. So mRNA is basically the instructions that the body then uses, once it goes into your body. So unlike the Johnson & Johnson, there is no like container. There is no little box that the mRNA is in. It's just that it's in the vaccine. The instructions are already there. You get injected in your muscle, and then right away your body starts reading what those things are, and right away starts making those antibodies. So the Johnson & Johnson and the Pfizer, Moderna aren't so different. It's just a way of how they get the instructions into your body. La vacuna de Pfizer y la de Moderna trabajan casi similar a la de Johnson & Johnson. La única diferencia es que en vez de tener como empaquetado en algo, la vacuna tiene las instrucciones ya puestas, que cuando uno se le dan la vacuna, ya el cuerpo de una vez puede reconocer que son instrucciones, no son que es algo como no parte del cuerpo. So, ve esas instrucciones y empieza a hacer los anticuerpos bien rápido, lo más que pueda, para que pueda reconocer en el futuro si está uno infectado o está expuesto a COVID-19, ya sabe qué hacer para eliminar esa infección. So here it just breaks down some of the ingredients, and we wrote them down because you just want people to know that, there's a lot of fancy names and all these things. And, we put them in parentheses of like fats, because you have to have something like a fat in order for it to get introduced into the body easier. There's salt, there's sugar, there's a couple of other things in there that basically what it does, it just helps it be more neutral. It basically makes it so that your body can absorb it. And then it basically is like pH balance. So it's not too salty, it's not too acidic, it's not too basic. It's general chemistry in a way of making sure that it doesn't throw the body out of whack. It's similar to if anybody's ever been in the hospital or have gotten any medications through an IV, usually you see like some medications also are put into like liquid, like saline, like salt solutions, in order because that's how your body's able to take some of that much easier with the electrolytes. It's very similar to that as well. So aquí también pusimos los ingredientes de las vacunas que hicimos para que la gente sepa que aunque tengan algunos nombres bien raros o largos, actualmente son cosas bien comunes, grasas, tipos de sal y azúcar que ayudan para que el cuerpo se puede introducir al cuerpo la vacuna, las instrucciones, como dije, para que todas, no tengan nada como anormal, y son cosas bien comunes. Si cualquier persona ha estado en el hospital o en emergencia, sabes que cuando le dan medicinas a veces le dan con una solución, como una bolsita de agua de sal, es casi similar. y es una manera de cómo puede uno introducir medicamentos fácil al cuerpo para que puedan trabajar más rápido. Okay. So why are vaccines important? People may have heard this term like online on videos about herd immunity. And herd immunity is basically at first there's only one person. If one person gets it, right, only that who gets a vaccine, only that person's protected, but everybody else around them is not. And what happens is the more people get vaccinated, get the shots, that means that there's less chances of people getting ill because there are more people protected. So like, it's basically almost like having like a wall around you, so that if something's trying to get in, the more people that are around you that can make and help form that wall, then whatever's trying to get in can't get in. And that's kind of like what herd immunity is like. Whereas there are going to be people who cannot get the vaccine for various reasons. There are also going to be people who probably won't want to get the vaccine no matter how long it's been out. And this is just, free will. Everybody, gets to choose, whether they want it or not. But especially for those, especially the very young, right? Kids, for right now, nobody under 16 years old can get this vaccine. So the more people that can get it, who can get it, the more that we can protect those people, they're really young, right? There's probably going to be some really, really old folks who are like, I've lived my life this long, I don't think I need it. So maybe protecting them, right? So the more that we can protect everybody around us, the better. And that's what herd immunity actually works. So for this country, we're thinking that anywhere from like 75 to 80% of people would need herd immunity. And that's probably like around like at least 200 million people if we're talking about a population of 300 million plus in the US. So hopefully, lots of people will get it, and talks like this will help change people's minds if they're, if they're not getting, if they're still considering or thinking about it. So esto indica solamente por qué son importantes las vacunas, y es algo que es la protección para la comunidad, y en inglés se llama herd immunity, que significa que cuando la mayoría de personas estén vacunadas, esas personas que no pueden estar vacunadas por varias razones o que tal vez no quieran ponerse la vacuna, estén protegidas también, porque muchas de las personas están vacunadas, protegidas, entonces COVID no puede seguir en la comunidad. Entonces, lo más personas que se puedan vacunar, lo menos el riesgo que COVID pueda pasarse de una persona a otra. Y así son la manera con otras vacunas en que podemos proteger a cada uno. Porque como dije, hay personas como los niños de 16 años, menos de 16 años, todavía no pueden recibir la vacuna. Solo más que podemos vacunar a los adultos en las vidas de todos los niños afuera, podemos protegerlos a ellos porque podemos prevenir que le dé COVID a ellos también. All right, next one. So here we have some, so we'll talk about a little bit like how well they work, right? So people hear about effectiveness, how well are they working? You hear these percentages and all these different things. So, we have the percentages down, but I just want to say, it's hard to really compare, let's say the Johnson & Johnson to the Pfizer, the Moderna, because it's a 1 dose versus 2 doses. And then they were made at different times of the pandemic So let's talk about Pfizer and Moderna, which are the first ones. They're about 94, 95% effective, which is amazing. And this is like what we call, you might start hearing what's called native or wild type virus, which means that before we got these variants, people hear about variants out there, they were tested out in what's called wild type. So the first COVID-19 infections, and they were found to be really, really, really effective. They were safe. The first thing when you do a clinical trial, when you look at how vaccine, something's going to work, you have to make sure first if it's safe to give to people. So once that was done and it was found to have no side effects like that can kill someone, let's say, then they brought a lot of people in it. So the Pfizer had 44,000 people and the Moderna had 30,000 people. And most of these, they had a high percentage of, BIPOC, so like Black, Indigenous, and people of color in the trials, which was just great because, the world is made up of lots of different people. And it was shown to be basically effective as it says there. The Johnson & Johnson came up later. It says it's 72% effective. It's as high as 81% actually has been shown too. So it can be a little high. And it has 45,000 people, but like I said, you can't compare it because it's a 1 versus 2 dose, right? So that's actually really amazing that 1 dose can prevent 72 to 81% of people getting COVID. It's what we do know is that all 3 are great in preventing death, 100% in preventing death, right? That's the worst thing that can happen with COVID, is that someone can die, get ill and die. So that all 3 can prevent death is amazing. That's what we want. That's what we're looking for. They also, can prevent, severe cases of COVID, meaning like, having someone having to get like a tube, down their throat because they can't breathe, like what's called the intubation or getting intubated. These are things we want to avoid, having to go to the ICU, the intensive care unit. So that, that we were able to make that these vaccines came out quickly and they're so effective is one of the reasons why we, as a doctor, you tell people to get vaccinated as soon as they can because they work very well. And these numbers show. So la función de esas vacunas están indicadas acá. Antes de yo hablar un poquito más sobre eso, me quiere decir que es un poquito difícil de comparar las 3 vacunas. Se pueden comparar Pfizer y Moderna porque trabajan iguales o bien similar y son 2 dosis. La de Johnson & Johnson es diferente porque es una sola dosis y cuando estaba en tratamiento, en los estudios, es un tiempo diferente, donde la Pfizer y Moderna se llaman el wild type, que es el coronavirus que salió a los finales de 2019. El de Johnson & Johnson empezaron a hacer los estudios cuando habían los variantes, que han cambiado un poquito, que la gente seguramente haya escuchado de Reino Unido, de Brasil, de Sudáfrica. Son un poquito diferentes, difícil de comparar, porque la gente ve que dice 72% de efectividad, pero eso es con una sola dosis, que es súper bien, comparado con lo de Pfizer y Moderna, que son 94, 95%, pero tiene que ponerse 2 para que sea así de tanta protección. Y lo que sí sabemos es que las 3 son 100% efectivas en prevenir la muerte de COVID-19, de la infección. Y también son muy altas en prevenir la COVID-19, coronavirus severa, que es cuando la persona tiene que ir a cuidado intensivo, tienen que intubarlo, ponerlo en un tubo para ayudarla a respirar. Son súper efectivas esas 3. Y lo que le digo a la gente es que hay personas que quieren una sobre otra, pero si son elegibles y pueden recibir una de las 3, que la reciba, porque es mucho más importante que tenga algo de protección que no tener nada. And before we just turn, I was just mentioning, that some people will say, well, I'm waiting for the Pfizer, or I want the Moderna, or I want the Johnson & Johnson. And people have their, preferences for various reasons. Mostly it's 1 versus 2 doses. But what I tell people is that if you're eligible and you can get one of the 3, just definitely get one of the 3. The faster we get people vaccinated, the faster that we can build that herd immunity and stop the spread of COVID-19, stop people, from getting hospitalized, dying. So that's what's most important right now. Let's see, what's the next one here? So,
sorry, this is just a graph of the nursing home deaths. So it's kind of like real world data to show.
Yeah, so what we're seeing now is that, there's some talks about what's called the 4th surge or the 4th wave. And what we're seeing is that that the numbers of people who are in the hospital for people who are 65 and older have gone down really like dramatically, like crazy amounts. And what we're seeing now is that folks who are in their like middle ages, so like 20s to 40s, are the majority of people who are now getting hospitalized now with COVID-19. And the reason for that is because, remember, the people in the beginning who can get the vaccine were, I mean, if you worked in the health field, but the people who are 65 and older. So those people have jumped on getting vaccinated, and we're actually seeing that it's working, because those are the people who are, if they've been vaccinated, they're not getting ill, they're not going to the hospital. And so we're seeing a shift. We're seeing younger people now being in the hospital, and people aren't dying as much as before, because if you're younger, you can withstand sometimes an infection of that rate. But people are getting hospitalized. They are staying in the hospital, have to be put on oxygen. You hear cases of people unfortunately dying who are young. But these are the real world data. And now I think recently there was showing that in the real world, I think both the Pfizer and the Moderna, there haven't been a study yet on the Johnson & Johnson, but there's a 90% effective against any type of COVID-19 infection, which is, awesome. It's still it's amazing. Let me just translate here. So estaba diciendo, en el mundo real, como se dice, estamos viendo que las personas que se vacunaron ya temprano, son las personas que fueron de 65 para arriba, el número de personas de 65 para arriba que han estado en el hospital ha cambiado. Ahora las personas que están hospitalizadas ahora son personas más jóvenes, entre los 20 y 40, porque ellos todavía no han sido elegibles, algunos de ellos, la mayoría, para recibir la vacuna. Pero las personas que tienen 65 años para arriba, que se vacunaron al principio porque fueron los primeros elegibles, se ve un cambio en las personas hospitalizadas. Ahora no son ellos, sino personas más jóvenes. El caso de muertes ha bajado drásticamente en este país, pero todavía estamos viendo que hay personas que desde hoy hasta el futuro van a estar hospitalizadas por esta infección. Lo mejor es vacunarse lo más pronto posible. So let's talk about, there's people definitely, and I hear this when I talk to patients in clinic, is this like, oh my God, like COVID, we heard about this in December, and all of a sudden in a year, there's a vaccine, or 9 months, right? Isn't it so soon and so quick? But I mentioned before that while the vaccine is new, the technology has been around for decades, so like years, so at least 20, 30 years. And part of it is that we never really had to use anything like this, because most of the vaccines we have out there really work really well, but this is a different type of virus. This is something, like I mentioned in the beginning, it doesn't matter who you are. It doesn't matter if you're young, you're old, you're, white, black, Latino, Asian, man, woman, doesn't matter. It doesn't really matter. And some people are affected more than others. Like if you have what we call, chronic conditions, chronic diseases, but it can affect anybody, even if somebody's in their 20s without any medical problems, it can affect that. So that's one of the reasons why, it was made so quickly. So a lot of money was spent by countries, by pharmaceutical companies. So drug companies were, putting basically all the resources, pulling things together, sharing information. I mean, you're talking about, a multinational, when we call multinational corporation, these are companies that basically are, work in the whole world. So Pfizer, and was developed by Turkish scientists, so it's an American company with a German, Turkish scientists who made this vaccine, and Moderna is US, but it's being, shipped out to other places. So because we're just trying to beat this thing, there's some treatments out there that if people have COVID, they may not work, but right now this is all we have. And that it came out so fast is because it's so necessary. I would say it's something like we never seen this before. And I'm not saying that it was made and then you just give. And remember, there were trials done. So the first trials were in March. So it's been a year actually that these vaccines have been out there, because you had to start the trials before you can give it out to the public. So the first participants were actually in March, were given the shot. So it's been out for at least a year. That it's, that it happened so quickly. You still have to go through this rigorous process, these really intense trials, where not only have to show that it's safe, but that it works. And if it works, does it work for many people? And if it works for many people, then are there side effects, over time? So there's a lot of checks that have to go before you can even go out there to the general public. So para personas que, sabe, a veces dicen que eso fue bien rápido, que COVID salió en diciembre de 2019 y en diciembre de 2020 ya tenemos una vacuna. Pero lo que estaba diciendo anteriormente es que la tecnología para esta vacuna, especialmente la de Pfizer y la de Moderna, ha estado, los científicos lo hicieron hace más de 20, 30 años atrás. So aunque la vacuna es nueva, la tecnología no es. Y la razón por eso es que COVID-19 es un tipo de infección que nunca, el mundo nunca lo ha visto antes. Está causando tanta destrucción que necesitábamos hacer algo, porque por ahora tenemos algunos tratamientos que podemos usar cuando uno esté enfermo, pero tal vez sí o tal vez no funcione para cada persona que esté infectado. So, por ahora, tuvimos que hacer algo rápido que podemos ayudar al mundo entero. Y esto significa que compañías, países, individuales, toditos, como pusieron todo su dinero, usaron todo, un montón de dinero, mucho dinero, el transfer, el intercambio de ideas, de materiales, de cosas, de estudios, para poder combatir este virus, porque como dije, nunca hemos visto algo así. Entonces, todo el dinero, todo el tiempo, todos esos estudios fueron solamente para tratar de hacer algo, un tratamiento que pueda combatir el COVID, y la vacuna fue eso. Y antes que la vacuna se pudo dar al público, tuvieron que hacer muchos estudios. Uno para enseñar que no causa ningún daño al público, a una persona. Después que es efectivo, que trabaja, y después que también trabaja en personas, en una población más grande, ¿verdad? Entonces, y también ahora ver si hay efectos secundarios también. So, aunque fue rápido, los primeros estudios empezaron en marzo. So, ahora sabemos que ya estas vacunas han estado afuera por un año. So, fueron aprobadas por el público en diciembre, pero en realidad se empezaron a usar en marzo para ver estos estudios, a ver si funcionan. Y podemos ver, como dije anteriormente, que son súper efectivas. Entonces, es una de las cosas que quisieran hacer, porque si hay una vacuna que salió temprano, pero no iba a ser efectivo, entonces el público no iba a recibir. All right. So just quickly, just going on some barriers, we always want to talk about this because, there's reasons why, people take certain treatments and why they may not. And, it stems from, systemic racism, specifically in this country, for lots and lots of, decades, I would say hundreds of years, against non-white folks. It's just, there's that, and it's the root of, a lot of misinformation, a lot of distrust. There's also lack of access, right? Because not everybody, even though these vaccines are approved, if we look at the data of where, people are getting them, it's not in a lot of Black and brown communities, and not because of not wanting, because people want it. It's just like where, especially in lots of different places where these vaccine hubs or places to get vaccinated are set up. And, hopefully with time, we're combating that. And we're introducing lots of places where people can get vaccinated. I think the cities doing a better job. I wouldn't say it's the best job, but it's doing, every day they're coming with new sites. The state as well. It's all about manpower. And right now, we're trying to break down these barriers because, they're out there. And anybody who says that these aren't, some of the reasons why people either can't get the vaccine or don't want it, is lying or, not being truthful. But hopefully, like talks like these, we can break some of those barriers, the confidence so that people are engaged, that we're talking with each other, where any sort of mistrust or maybe misconceptions or myths and things out there, we can talk about them so that people feel really confident and that when they go get the vaccine, they're like, this is the best decision I made for myself and my family. So we wanted just to talk a little bit about that. Hablando sobre las barreras, pusimos aquí algunas de ellas. El racismo sistémico, especialmente en este país, es ¿cómo se dice? Lo que como que causa muchas de esas barreras, ¿verdad? No solamente pero por todos los años donde personas que no eran de raza blanca no pudieron recibir tratamientos en el pasado o sí recibieron tratamientos no fueron los mejores o hay como desconfianza, desinformación. Parte es por el racismo, pero lo que estamos haciendo con esas charlas como de hoy, como ahora, es hablándole al público para que tenga más información, que tenga confianza cuando se ponga la vacuna, que han hecho la mejor decisión para ellos y para sus familias. Y tal vez y la ciudad, lugares como nuestra clínica, varias clínicas, el estado, está tratando de mejorar el acceso a la vacuna. So, a cada rato tenemos varios lugares nuevos donde están poniendo la vacuna. Lo que tenemos que hacer es educar a las personas de cómo poder vacunarse o cómo buscar, y ojalá la ciudad y el estado y este país puedan hacerlo mucho más fácil para que cualquier persona que quiera vacuna pueda ir a donde sea y se la pueda poner hoy o mañana. So, eso es una cosa para el futuro. So we can just briefly go over the next one. So these are just, in terms of finding credible information, there's always, social media is great. It has a lot of, amazing resources. I think it's amazing because it can really spread information out there, to people. We just have to be careful with, some of what kind of information it is and where it's coming from. So we just, highlighted here, in terms of checking sources. If you go to any web pages and then, the endings of .gov, which is like the government, or .edu, which is education, or .org, which is an organization, usually nonprofit, that they will have accurate information, things that have been what we call vetted. So it's been checked versus, someone going on YouTube and putting something up, or Facebook. And unless they put down the studies or it's not just anecdotes, it's not just people's stories. It's, looking at the whole picture, that's how we can fight misinformation. So aquí tenemos cómo buscar la información para que no, porque hay muchas social media, so lugares como Facebook y WhatsApp y YouTube y cosas tienen mucha información, y Instagram tienen, son páginas y lugares donde se puede introducir información y para que el público pueda verlo, pero tenemos que darnos cuenta también donde viene alguno de esa información. So, si ve páginas de la red que terminan con .gov del gobierno, o .edu de educación, o .org, que son organizaciones, muchas veces esas son lugares donde la información la han chequeado por varias personas, varias organizaciones, que sea precisa, que no tenga información falsa. Son maneras que pueden hacer para combatir la desinformación. So, I mean, and this is just some you know, historically mistreatments of, you know, what's going on and why people may, not trust, right, the government, or not trust like clinics or specific doctors and things like that because of neglect, or, not treating people the right way, right? So, and hopefully, you know, I mean, I'll say everyone doesn't know who I am here, but hopefully, by the end of today's talk, you'll trust me a little bit more than when we first started. And, my job is basically, this is what I do every day when I talk to patients, is, trying to go over these issues and any questions, so that we can kind of break down and, years of mistrust in healthcare and in the health profession and as doctors, or, that it won't go away, but hopefully, I'm doing my part in trying to build that trust in our groups in Black and Brown communities, because, we need everybody to kind of, I guess, believe in a way, to trust this, because, while, COVID, I mentioned, affects so many people, it's really affecting, Black and Brown communities the hardest, right? We're the folks who mostly, we can't telework, we can't work via computer, we have to be there in person. We're providing for our families, we have to work, we have to interact with other people every day, so that, if there's something out there that can really tip the scale so that things are a little bit more equal, and it's going to take time for that to happen. But if there's something that can help us with that, this is why I talk about the vaccine and why I'm so passionate about it, because I've seen it, how bad it's affecting us. So that, those are one of the reasons why I do these talks. Aquí solamente algunos ejemplos de el maltratamiento de parte de profesionales de salud en este país, y por qué la persona tal vez no pueda tener la confianza en profesionales como doctores, como yo. Pero ojalá esta charla, esta presentación, pueda por lo menos darle un poquito de confianza al final, que estamos hablando sobre estas cosas, las barreras, la información, para que, ¿sabe?, tengamos un poquito más de confianza no solamente en el sistema, pero como dije, este tratamiento. Lo digo porque he visto que aunque COVID-19 afecta a cualquier persona de cualquier raza, etnicidad, la mayoría de personas, especialmente en este país, que está afectando son las personas que son de raza negra, latinos, personas que no sean blancas, ¿verdad? Porque somos población donde no podemos trabajar por computadora, así por video. Muchas veces tenemos que estar en vivo, interactuando con personas para poder ayudar a nuestras familias. Entonces, hago esas charlas porque es importante para mí, para que la gente sepa que vacunas están ayudando mucho, están protegiendo a muchas personas, y si hay una manera donde el balance, donde las personas que no sean blancas tengan su salud, que no mueran, que puedan seguir trabajando para sus familias y para sí mismo, ¿por qué no usar algo que es efectivo y también que previene la muerte o daño, como esta vacuna? Y por eso son razones que yo hago estas presentaciones. So this is just a map of places, of access, and you can see on the left, if you see the little really thin, you can see like, where it's like really heavy, right? There's a lot of, and unfortunately that's Manhattan. And, we're still seeing that, the places that has less people, but have more people with more money, the ones that are getting it first, or there are more sites. And this can be repeated all over the country. But like I mentioned before, there are opening more sites. I know the mayor and the governor have specifically said, that they're looking to put new sites in places where, people want them, but they're not, in some of these not affluent areas or places, you know, less money, or places basically that have been affected more, right? So the South Bronx is heavily affected. So we should definitely have more sites. And I'm praying, you know, that we do get more besides the 3rd Avenue Bathgate station soon for the city. I mean, there's other ones out there. And luckily, you know, like pharmacies are also now giving vaccines as well. So that's another, you know, less barrier. But, you know, like I said, hopefully as time goes on, you'll see not only Manhattan, but the Bronx, Brooklyn, Queens, Staten Island, basically all these places that have a lot more people. Basically, you will have, you know, you can't see almost all, you know, can't see any white. You'll only be seeing blue dots on there on that map. Y este mapa indica, como ven, hay áreas donde hay muchas más puntos azules. Y si han visto un mapa de Nueva York, saben que es la parte de Manhattan y otras partes que ven el Bronx y Brooklyn y Queens, Staten Island, que no hay tantos sitios. Y lo mismo se puede decir para otros lugares en Estados Unidos, donde los sitios que son más, dice que tienen la gente más rica o que tiene más dinero, o es que tienen mejor acceso o primer acceso. Pero con el tiempo lo que estamos viendo, ojalá, es que cada semana un nuevo sitio para la vacuna está abriendo en la ciudad, en el estado. Yo sé que el alcalde y el gobernador han hablado sobre haciendo más lugares, más sitios para la vacuna en lugares donde COVID afectó mucho, como en el Bronx y en Brooklyn y en Queens. Otra parte que no sea Manhattan. Y lo que espero es que cada semana abren un nuevo sitio donde cualquier persona que quiera tener la vacuna pueda obtenerla sin tener que esperar. Y ojalá sea así en ahora en adelante.
Just want to flag 2 things, Dr. Frias. One, or just to the group, the op-ed article that's on here is really, really wonderful, and it's by a pediatrician who actually came to speak with our clinics, Dr. Rhea Boyd, about how a lot of the media attention around minority communities has been about, you know, vaccine hesitancy and not a lot of focus on access. So if you get a chance to definitely read that. And then also, as we're moving in now to the next slides, are going to be about different myths. Just because of time, I would advocate maybe you should just do it in English, if that's okay. And then those Spanish text will be up there, just because it might take a little while to go through if you're translating, if that's
sure.
okay.
Yeah. So, let me just say it in Spanish. So, voy a poner tenemos aquí los mitos y la desinformación para que la gente sepa lo que es real y lo que es. Voy a hablarlo en inglés solamente para tiempo, para que podamos tener preguntas al final, pero va a estar en español también para la gente si puede leerlo. So let's going over some myths about you know, things out there. One is like, if people have already been infected with COVID-19 and they're doing well, do they need to get vaccinated? And I tell everybody it doesn't matter. I tell everybody, even if they just recently got over quarantine, if they can sign up to get the vaccine, to get it right after. We just know that when someone is vaccinated, it actually gives you better protection than if you were infected. It's this, you know, it's true for, going to be true for COVID-19. It's true for the measles. It's true for chickenpox. It's true for lots of these other vaccines that we have out there, where actually being vaccinated gives you a longer lasting protection than being infected. And I see this every day because I have patients who were infected a year ago with COVID-19, and then they want to check their antibodies, you know, via a blood test. And I'm getting more people who come back negative, meaning that either their antibodies, they have no more, or the levels are low to be detected. So, which means, you know, we're still learning a lot more, but most likely means that they can probably, you know, they can get reinfected, and people can get reinfected, and they do get reinfected with COVID. This whole myth of also like, if you got it once, you know, you can't get it again is not true. We're seeing more cases now of people getting reinfected. It's not as often that you hear about it, but it's also because I think sometimes people don't, either they were never able to get tested in the past, so they never really knew, but they, you know, it was really that they did have COVID and now they got tested, or they got tested before, had COVID, get the same symptoms later, and then decide not to get tested, just doing the quarantine out there. But they can. So if you can get it, you should, because the protection will last. How long will it last? We're still figuring that out. Like I said, it's a newer vaccine, so we're still doing testing, you know, in terms of how long the immunity lasts. But we do know it lasts longer. This other myth about like causing infertility or miscarriage, it was, you know, now there's actually a study that's come out of thousands of women who were vaccinated either when they were pregnant. So after the vaccine was approved, they decided to get it themselves. Mostly there were women who were in the health field and they were pregnant and they want to protect themselves. So they did that, or women who got the vaccine, they got pregnant afterwards. So there's a study that came out that showed really there's no, that women who were pregnant had babies who were healthy, and also women who weren't pregnant but then got pregnant also have healthy babies and they had healthy pregnancies and that they were able to get pregnant. So for now, there's no evidence showing that people can't get pregnant or stay pregnant. That there's a microchip, that there's a way for people that the vaccine can then tell people, like the government, where you are, or, you know, track you. And there isn't any microchip. I mean, it's hard to do. It's super, like, even if that were possible, it's super expensive. But basically it came out from what's written is that Bill Gates at one point said that maybe there should be, you know, there'll be like some certificates or basically like records, right? Which people are probably hearing now, they're called digital passports. And it's not that it's a way to kind of tell, like, you don't have to sign up for any of these things. But what he was trying to say is that probably is that companies and countries may want to have to know that people have gotten vaccinated. And actually that's kind of what's going to start happening, I think, with these passports, is that countries or places, concerts or things, in order for you to have access to them, they may or may not require people to get vaccinated. And, you know, it's not, they're private companies and private, we call entities. So they don't, you know, it's not required. They don't have to, they can do kind of what they want. But it's, you know, we're seeing that it may be true that either you get tested every time, or if you have the card that shows that you've been vaccinated, then you don't have to be tested. So, so I'm a Yankee fan, so I love baseball. And right now they're seeing that if you want to get tickets to be in person, that's one of the conditions, whether people get tested or if they have their vaccine cards, they don't have to, and you can go see them live if you're able to. So, but they might start doing that for other things as well. The vaccine will alter my DNA, because you hear something called this RNA and things like that. But one, the RNA can't get into your DNA. It just doesn't work. Once you've been vaccinated, the body quickly reads the instructions, as I mentioned, and then it breaks down. It goes into your muscle. It doesn't go anywhere else. It doesn't go any part that where it could even try to get into your DNA. You know, so it's hard to sometimes explain that, but it's like I said, it's been tested. That's one of the safety things that was done from the beginning. And one of the other ones is an allergy to eggs or anything like that. Thinking about like the flu vaccine, where people may have some what's called anaphylaxis or like a really bad reaction. But the vaccine isn't made with eggs. It's basically made with the ingredients I mentioned before. The only people who can't get it, or that who should really consider getting it under like a watchful eye of like an allergist or a really, you know, highly trained professional, is people who have an allergic reaction to like a vaccine, because a lot of vaccines share the same ingredients. So if anybody has had an anaphylaxis or like a really severe reaction to a vaccine, or one of the vaccine ingredients, then, then that's one of the reasons why, talking to someone about that before just signing up. But otherwise, even if people have allergies to like antibiotics or certain medications or foods, they can still get the vaccine. The thought, it was thought about like people who have severe reactions to foods or medicines or other medicines in the beginning. Now we know that's not true. That people who have even if they have anaphylaxis, severe reactions to certain medications or foods, they can still get it as long as it's not to the ingredients in the vaccine itself. So quickly with these, so can you get a dose of one and then get another? So for now, there's studies out there looking to see if you can mix and match. But for right now, if you get the Pfizer one, then you get the second should be Pfizer, and Moderna is the same. Johnson & Johnson, you don't have to worry about that because it's one shot. And then am I fully immune after one dose? Although now real world studies show that after one dose of the Moderna and the Pfizer, it's up to 80% effective. You want to go for the goal. You want to go for the highest protection itself. So you definitely need to get two. So you want to go as high as you can, 100% protection, right? So you definitely want to get two of them and not just one. I mentioned about the allergies. If anybody has specific questions, definitely always talk to your doctor or a provider. And then, once I get the vaccine, can I spend time with others without a mask on? The guidelines recently changed, showing that if people are in a group and they've all been vaccinated, then they can kind of congregate, they can come together in a group. I still tell people, and I've been fully vaccinated, I still wear my mask outside, because you still want to protect yourself, and most of it is also protecting other people. And by wearing your mask, it also shows, others, right, that you're taking their health and my health into consideration. So I tell people, even though the risks of it being passed, of people getting reinfected are super low, or getting infected in general are super low once vaccinated, for now, until everybody is vaccinated, we have almost everybody vaccinated, we'll still have to wear a mask. So we're still going to be doing masks for at least another year. So how many have people died from getting the COVID vaccine? So there hasn't been anybody who's directly died from getting the vaccine, like getting the vaccine and then they die right there. People have had reactions. There have been other maybe side effects or severe reactions afterwards that could be related to the vaccine. But what I tell people is that it's not just COVID vaccine. You can get severe reactions to any vaccine. You can get it to the flu shot. You can get it to a lot of different things. We don't know why some people get certain reactions after getting this one or other vaccines in general. But if you look at, there's a big database. There's a big basically like a list, like a registry for people, for any side effect that could happen afterwards, where people sign up and they tell, and the US, is by law has to collect this data because they have to present it. So as of yesterday, there've been 95 million people in the US who've gotten at least one dose, which is amazing. But you don't really hear these stories of people getting the dose and then just dying right there. And I mentioned before, you can't get COVID-19 from the vaccine because there's no virus. There's no COVID vaccine in any of the vaccines. So one of the questions, so this is one of the things I tell people when they get the vaccine, is that you will get a reaction. You will feel something, and it's actually normal. It's actually your body's natural ability to make what's called the antibodies, as I mentioned, the protection. So when people get, sometimes they say, well, I got the flu shot and I got really sick and I don't want the flu shot again. And there's actually no way to get the flu from the flu shot. What people are getting is their body's making the antibody, is making the protection. And when your body does that, it's working like overtime. It's working really hard to make these things so that if you ever are exposed, or if you're ever around an infection or virus, then your body already can recognize it right away and fight it off. The same is true for the COVID-19 vaccine. Once you get the shot, you'll feel, pain in your arm. I always tell people that there's going to be some soreness. And they may get, maybe chills, body aches, fatigue or tiredness, maybe some headaches, maybe even like a low-grade fever. But that's because your body's working really hard to make that protection. So you're not coming down with anything. It's just that's just a natural, and that's actually a good sign that your body's working the way it should be. And usually these side effects will last like 24 to 48 hours, and then all of a sudden it goes away. So everybody's different. Personally, when I got the second dose, and usually it happens after the second dose, I did start feeling like chills and body aches. I took some ibuprofen. I was able to go to work. I was able to play with I have a 2-year-old, so I was able to play with him. Everybody's different, but literally the next day, 24 hours afterwards, it's like I didn't have any symptoms. And some people may hear from friends or family members that they got it, and this may have happened to them, but all of a sudden it went away. Versus like if somebody were to get COVID and maybe that person never had back symptoms, or maybe that person lost their taste and smell for a couple of days or a week. But there's also the people who lost taste and smell for weeks or months. So the side effects of COVID, I feel, are worse than what any of this reaction may be from the vaccine. Not to mention it's very short, and then you're protected. So I feel like the benefits fully outweigh the risks or any sort of reaction that somebody may get, because it's, as I mentioned, short-lived, and it leads to protection for a long time. And last one is, can I get the flu shot or any other vaccine at the same time? So what I tell people now is that if they're really interested in getting it, is to kind of postpone any other vaccine they may need, unless it's like dire, unless it's like life or death. And I'm talking about like flu shot, shingles, measles, mumps, rubella, tetanus shot, things like that, where like, routine things to protect us. So you have to wait at least 2 weeks after getting to get the COVID vaccine if you've already been vaccinated recently. So what I just tell people is, if you're really interested, just hold off on the other one for now, and then just really focus on getting the COVID vaccine. Once those 2 weeks are done after the COVID vaccine, then you can schedule the other one, because those other ones will always be there, right? The tetanus vaccine will always be there, but the COVID, is much more important for right now. And just some data on New York State, just 30% of the population has at least one dose. We talk about disparities. You see here, Riverdale, which is a very affluent, very like rich area of the Bronx. It's got already 46% versus where in Hunts Point is 18% or 25% in Mott Haven. So hopefully, like I said, this access to getting the vaccines is changing really, really, really quickly. And you'll see basically 100% all across the board. Starting as of today, anybody who's 30 and above, it doesn't matter if you have any medical problems, if you're 30 years old and you're healthy, you can get the vaccine. Starting next Tuesday, you can, folks 16 and over can get the vaccine. So if you're 16 and want the vaccine, or the parent wants the vaccine, for right now, only the Pfizer one is approved for 16 and above. Both the Johnson & Johnson and the Mrna are 18 and above. And you shouldn't have to pay for any vaccine. So if anybody is trying to say, you need to pay to scam, watch out for any sort of text or anything asking you for any information like date of birth, unless you're on a website that does ask you that. It's either like a city agency or a clinic or things like that you're signing up for. They may ask that information, but other than that, you shouldn't get like a text or anything like that. Just be wary. And then just eligibility guidelines. And then just at the end, you just, some pictures. That's actually me at the first one on the left, and just reasons why. These are all providers. Leah's that fifth one from the left, third one from the right. That's her there. I think that's the last one. And it took a little bit of time, just translate, interpreting the slides, just translating in Spanish. So hopefully, we have some good questions. Acabamos, perdón que no pudimos traducir todo al final, pero queríamos abrir todo para preguntas para el público.
Great. Thank you so much, Dr. Frias. That was so helpful, and I learned a lot, and a lot of the questions that I had asked and we had seen, you answered a lot of them. So that's incredible. So thank you so much.
Sure.
A couple of questions we had from the community at Casita is, are there any tips to kind of help encourage maybe elderly family members who are hesitant to get the vaccine? Obviously everyone's different, but some general tips to talk to, especially elderly family members, about getting the vaccine.
Yeah, I think the elderly are unfortunately the ones who, if they get infected, a lot of them are the ones who are been dying in the hospitals, just because their immune system is a little, it's not as strong as it was in the past. So when they were younger, so it's, it's a way to protect themselves from any of this, because we're seeing, that sometimes it's the young people in the family who are bringing it in, and they don't know because they don't have any symptoms, and then they pass it to someone else, right? And it's really unfortunate when that happens, because there's a lot of guilt and blame and things like that, and it's just a lot of things going on there. So I tell it's the best way to protect yourself, right? It's now we have three ways to do it. I feel like the elderly are probably a little not easier for them, but they had, there's a lot of now areas still that are just geared towards seniors, which is great because they are the most vulnerable. We didn't put it in the slide, but if anybody is 75 and older and they need an escort or somebody to go there, that person, that escort, and that elderly person, 75 and older, you can walk in to get a vaccine. You don't have to make an appointment. It's probably the easiest way to get a vaccine if you're older and young. So if you have a grandparent or great grandparent who wants it, and you both want it, you can both literally walk in to a site, go get the vaccine, and go home. It just started, I think it was yesterday. It was done. So I think it starts today. But and the other thing I tell people is, some people are worried about the side effects, like those reactions. And we do, in the studies that were done, actually, because their immune system is not as strong, the side effects of the reactions weren't as strong in the elderly. So like the headaches and the body aches and the chills and fevers and things like that, it actually happened less in the elderly than in younger people. And it's just because they're, like I said, the immune systems aren't as strong, so they're not building as big of a response, but the response is there and they're doing that. So la pregunta era, ¿qué podemos hacer para que las personas mayores estén más cómodos en recibir la vacuna? Y lo que digo a cada persona mayor que sean paciente mío es que ustedes son los más vulnerables. So, desafortunadamente, las personas que han muerto más en los hospitales o en casa o cosas así son personas más mayores, porque el sistema inmuno, la protección no es tan fuerte. So, esta es una manera de poder hacer como un refuerzo del cuerpo al sistema inmuno para que pueda protegerse contra el virus. Y también sabemos ahora que personas que son de 75 para arriba, 75, y si hay otro familiar que quiera ponérsela, esas dos personas pueden ir a un lugar, no tienen que anotarse, pueden ir walking como a un sitio y se puede poner la vacuna ese mismo día. Esto cambió desde ayer. se pueden hacer walk-ins, una persona de 75, 75 para arriba, con otra persona que sea menor, saben, menor de esa edad. Las dos personas pueden ponérselo a la misma vez. Y la persona que tenga un poquito de miedo sobre las reacciones que pueda darle después de la vacuna, los estudios enseñaron que personas que son mayores tienen una reacción un poquito más leve, no tan fuerte que personas que son más jóvenes. Esos efectos de dolor de cuerpo, resfriado, dolor de cabeza, fiebre, puede ser que le dé un poquito menos. Y eso es porque el sistema inmune no es tan fuerte, no tiene una reacción tan fuerte tampoco. Lo que le digo a todo el mundo que puede tomar ibuprofen, o acetaminophen, Tylenol, después si tiene algún síntomas. I didn't mention it before, but anybody who gets any sort of reaction, just taking Tylenol, acetaminophen, or ibuprofen, like your Motrin, Advil, like if that happens, it's fine. You can take it. I would recommend taking it afterwards, not before, though, because we don't know. We just want to make sure that when you get the vaccine, you're building that response as strong as possible. And then if you get a reaction, then take that, but try not to take it before. Pero no, estaba diciendo que no, si como puede tomar Tylenol, acetaminofén o ibuprofen, que se lo toma después de la vacuna, si tiene una reacción en vez de antes, porque queremos que después que uno esté vacunado, el cuerpo haga el esfuerzo más fuerte para hacer los anticuerpos. No queremos que una persona tome algo antes y el cuerpo no haga ese esfuerzo para esos anticuerpos. Porque también puede hacer que no le dé ningún tipo de reacción, no van a necesitar las medicinas.
Thank you so much. That's so helpful. And I didn't know that about the walk-in appointments. So great to know. We'll just ask one more question for this evening. And you talked about a little bit about this, but we had someone asking about when after, like how, I guess soon after the vaccine, is it safe to, we were talking about those small group get-togethers, when is it safe to hug people, like about how long after you get the vaccine is it recommended that that's safe?
That's a great question, yeah. And Leah, I don't know, I think it was in the slides, but I can't remember, but 2 weeks after you get what's the last dose? So you're 2 weeks after getting the second dose, if you're doing the Mrna or Pfizer, then you're like fully immune, like you're fully protected. And the Johnson & Johnson, same thing, 2 weeks after getting your 1 dose. And unfortunately, I just, one of the students I mentor, her father actually got the Johnson & Johnson, and a week later he was hospitalized, or he's been hospitalized because, even though he got the vaccine, it does take time. And, unfortunately, if it was like a week later that he was exposed to someone, maybe he wouldn't have to be in the hospital. But you want to give yourself that whole 2 weeks for after that, so that you're fully protected, and then you can make your own, make your pods or hubs or whatever, amongst yourselves when you're fully vaccinated. So that's the answer to your question. Is I always tell, that's what I tell, and that's why I also said that if you want to get another vaccine, wait the 2 weeks as well. So la pregunta era que cuándo es que una persona esté protegida, cuándo es, después de cuánto tiempo es que uno puede congregarse con otras personas que tal vez estén vacunadas o con otros familiares en un grupo pequeño, y son 2 semanas después de la última dosis. So, si una persona le ponen la Pfizer o la Moderna, son 2 semanas después de la segunda dosis. Si le ponen la Johnson & Johnson, son 2 semanas después de la única dosis. So, siempre 2 semanas después, y eso le da al cuerpo suficiente tiempo para hacer una reacción necesaria para tener el máximo efecto de los anticuerpos en el sistema.
Great, thank you so much. Appreciate your time tonight.
I want to thank everybody. Thank you for inviting me. And hopefully, lots of people got lots of good things from this. And if anything, I hopefully it was able to get people thinking about and really considering getting it if they weren't getting it before. But thank you so much, and thank you for your time.
Yeah, I also just want to add, like, thank you to you all for all the work that you do in the community, and also kind of hopefully that this presentation also gave you all some confidence to be able to talk about it as
Mhm.
well, because, we have the expert on the phone with us, a provider, but it's also important that we feel comfortable in having conversations that we have the best facts. So I really hope that it empowers all of you all to talk about it with your friends, family, and people you work with in the community.
Ditto.
Yes, thank you. I certainly learned a lot. I am vaccinated, and even learning things after getting vaccinated, it allows me the opportunity to speak to those who may not be as confident. So thank you so much for joining us. Yes, unfortunately, we have run out of time. It's close to 7 o'clock, so that brings us to the end of our conversation. But to piggyback off what Leah was saying, I do encourage anyone to share what they've learned today with their neighbors, friends, and family. There's a lot of confusion and uncertainty out there. So the more that we know, the better we can create our own opinions and move forward with our decisions. Desafortunadamente, se nos ha agotado el tiempo. Por favor, comparte lo que aprendió con sus vecinos, familiares y amigos. Hay mucha confusión y cuanto más sepamos, mejor podremos crear nuestras opiniones. So thank you so much to everybody who made today possible and speaking with us. A special thanks to Leah and Dr. Frias for putting this together and for getting the word out into the community. What you guys are doing is really, really great and beneficial, and it's things that we need right now, particularly in BIPOC communities. So thank you so much. Thank you for everybody who's here, and have a great night.
Thank you.
Good night.
Good night.
Thank you.
Bye-bye.